Picture a 68-year-old man named Gerald standing at his kitchen counter on a Wednesday morning. He lines up 4 pill bottles the way he has every morning for 3 years. He takes them without water, just tips them into his palm and swallows. His doctor prescribed 2 of them. The cardiologist added a 3rd. The pharmacist suggested the 4th for his swelling ankles. Nobody ever put them in the same room together. That afternoon, Gerald sits down after walking to the mailbox and cannot get back up. His legs will not cooperate. The room tilts. His wife finds him on the floor 20 minutes later. Every single day in this country, seniors are combining blood pressure medications in combinations that create cascading failures inside their cardiovascular system. Not because their doctors are incompetent, because no single doctor sees the full picture. And the result is landing people in emergency rooms for events that were entirely, completely, preventably avoidable. Here is what nobody is telling you clearly enough. The danger is not always in the pills themselves. It is in the combinations. And certain combinations that are prescribed routinely and considered individually safe are actively dangerous when they share your bloodstream at the same time. By the end of this video, you will know exactly which combinations to watch for, what they do inside your body when they interact, and the specific questions to bring to your doctor that most people never think to ask. Most people believe that if their doctor prescribed it and their pharmacist dispensed it, the combination is automatically safe. That belief is costing people their lives. The reality is that drug interaction screening in a busy clinical setting is often incomplete, particularly when your medications come from more than one prescriber. 3 separate doctors have never had a single conversation about what you are swallowing every morning. That is not a failure of character. That is a failure of a system that was not built for patients managing 4, 5, or 6 conditions simultaneously. Sluber to Fauci Health Insights right now and tap like, it takes 4 seconds and it matters more than you think. We are working toward 50,000 subscribers, and this channel exists on one conviction. The office visit that prevents something does not generate the same revenue as the office visit that treats something. That math is not neutral. It shapes what gets said and what gets left out. What I am about to explain, nobody is going to write on a sticky note and hand you at your next appointment. There simply is not time. And frankly, the financial structure of medicine does not reward the conversation I am about to have with you. So let me show you what is actually happening inside your body when certain blood pressure medications share your system, because once you understand the mechanism, you will never look at your pill organizer the same way again. Your cardiovascular system is one of the most precisely calibrated pressure systems in the human body. Picture a network of plumbing, thousands of miles of pipe ranging from thick main lines down to threads so fine they are invisible to the naked eye. The heart is the pump, the vessels are the pipes, and blood pressure, that number your doctor checks at every visit, is simply the force that blood pushes against the walls of those pipes as it moves through. When that pressure is too high for too long, the pipe walls thicken, they stiffen, they lose their elasticity, that natural spring that lets them expand and contract with every heartbeat. In healthy vessels, this elasticity is like a garden hose that gives slightly when you turn the pressure up. In damaged vessels, it is like old rigid copper pipe. One pressure spike and something gives way. Blood pressure medications work by interfering with specific points in this pressure system. Some widen the pipes, some reduce the pump speed, some drain off excess fluid that adds volume and pressure, some block the hormonal signals that tell the pipes to constrict. Each mechanism is real and clinically valid. Each one, in isolation, does its job. The problem begins when 2 or 3 of these mechanisms are active in the same body at the same time without being coordinated. The pipes get widened while the pump is slowed, while the fluid volume is reduced. All simultaneously, the pressure does not just go down, it crashes. And when blood pressure crashes suddenly in a 67-year-old body, the brain does not receive the flow it needs to function. A drop that would cause a young person to feel briefly lightheaded causes a senior to lose consciousness, lose coordination, or worse. This is called orthostatic hypotension, which simply means your blood pressure drops dangerously when you stand up or change position. It is the leading cause of falls in seniors over 65, and it is frequently a direct consequence of combination medications that nobody audited together. This process hides. For months, sometimes years, the combinations create micro events, a moment of dizziness, a brief tunnel vision standing up from a chair, a stumble that gets blamed on fatigue. The body compensates until the day it cannot compensate anymore. That is the day Gerald ends up on the floor. Sign 1. Dizziness or sudden lightheadedness on standing you. Push back your chair after breakfast, stand up, and for 2 or 3 seconds the room tilts. Maybe your vision goes briefly dark at the edges. You grab the counter. It passes. You tell yourself you stood up too fast. You have been doing it for months. What is actually happening in that moment is this. Your heart and vessels have been chemically instructed by 2 or more medications to simultaneously reduce pump output and widen the pipes. When you stand, gravity pulls blood downward into your legs. In a healthy system, automatic reflexes instantly compensate. Vessels constrict slightly, heart rate ticks up, pressure holds. But in a system where a beta blocker, a drug that slows your heart rate and reduces pump force, is working alongside an ACE inhibitor or calcium channel blocker, drugs that relax and widen the vessel walls, those compensatory reflexes are blunted. The pipes cannot tighten, the pump cannot speed up, blood pools in the legs, the brain gets less, the room tilts. Most people blame age, tiredness, or not eating enough. That explanation feels reasonable. It is not. It is dangerous. If this happens more than twice a week, it is not tiredness. It is your body telling you the pressure balance in your system is wrong. A fall from this moment in a bathroom, on stairs, near a glass shower door can be permanently life-altering. The clinical name is orthostatic hypotension, and when a senior describes this to a cardiologist, the first question should be, what else are you taking? Not, here is another pill, but that is only the first sign. The second is one almost every senior has experienced and almost none have connected to their medications. Sign 2, extreme fatigue that sleep does not fix. It is not ordinary tiredness. It is the kind that sits behind your eyes. You sleep 8 hours and wake up heavy. You sit down after a short walk and do not want to move for an hour. Your family thinks you are depressed. You wonder if it is your age. When a beta blocker, a medication that deliberately reduces your heart's pumping speed and force, is combined with a diuretic, which is the medical word for a water pill that pulls fluid from your bloodstream and sends it out through your kidneys, the result is a circulatory system operating under double restraint. The pump is slower. The volume is lower. Less blood reaches working muscles per minute than your body is demanding. Muscles starved of adequate flow produce a chemical byproduct called lactic acid, the same compound responsible for the burn you feel in a hard workout. At low levels, sustained throughout the day, it creates a deep, full-body heaviness that feels nothing like normal tiredness. The common explanation people give themselves is that they are getting older, not sleeping well, or just slowing down. That is wrong. Slowing down is not supposed to feel this heavy. It is supposed to feel gradual and manageable. If the fatigue began or worsened after a medication was added or the dose changed, that timeline is not a coincidence. That timeline is evidence. Left unaddressed, this sustained undercirculation accelerates cognitive slowing, reduces immune function, and increases cardiac stress as the heart works harder to compensate for its own chemically imposed limitations. The clinical term is medicating-induced fatigue secondary to hemodynamic suppression. When you describe this to your doctor, use those words. They will understand exactly what you are pointing at. The third sign is quieter than both of these. That is what makes it the most dangerous of all. Sign 3, swelling in the ankles or lower legs, that comes and goes. Your shoes feel tighter by afternoon. When you press a finger into the skin above your ankle, a small dent stays for a few seconds before it slowly fills back in. Some mornings it is gone. Some evenings it is back. It has been going on for so long you have stopped mentioning it. Calcium channel blockers, One of the most commonly prescribed blood pressure medications, which work by relaxing the muscle inside vessel walls so the pipes stay wider and the pressure drops, have a well-documented side effect that most people are never warned about. They cause a specific type of fluid leakage at the level of the capillaries, those ultrafine vessels at the end of every circulatory pathway. Fluid seeps out of the vessel walls into the surrounding tissue. It pools downward. It collects in ankles and feet. Here is where the combination problem becomes circular and dangerous. A doctor sees the ankle swelling, does not connect it to the calcium channel blocker, and adds a diuretic to reduce the swelling. Now, the calcium channel blocker is widening the vessels and leaking fluid into tissue, while the diuretic is pulling fluid out of the bloodstream to compensate, but it cannot pull fluid from tissue, only from the bloodstream. Blood volume drops. Pressure drops. The dizziness from sign 1 worsens. The fatigue from sign 2 deepens. And the swelling often persists because its source, the calcium channel blocker, was never addressed. This is not a rare scenario. This is happening in tens of thousands of homes right now. If your ankle swelling began after starting a calcium channel blocker, that information is clinically essential. Your doctor needs to know that connection, and many never make it unless you say it directly. Let me tell you about a patient I will call Miriam, 73 years old, the kind of woman who kept a handwritten list of every medication, dose, and prescriber, color-coded, updated monthly. She had done everything right by every standard she had ever been given. She came to me not because she felt terrible. She came because she had fallen twice in 2 months, and her daughter had insisted. Both falls had happened getting out of bed at night. Both had been written off as clumsiness. She was using a nightlight now. She had moved her water glass to the bedside so she would not have to walk to the kitchen. She was on 5 medications, 2 prescribed by her internist, 1 by her cardiologist. 1 she had been on for so long nobody remembered who started it. 1 her previous doctor had added for ankle swelling that had never fully resolved. I did not ask first about the falls. I asked her to stand up from the chair and tell me what she felt. She stood. 3 seconds later, she reached for my arm. "There it is," she said. "That happens every time." Her blood pressure lying down was 138/84. Standing, 30 seconds later, it was 96/61, a drop of over 40 points. In 30 seconds. She was walking to the bathroom at night in that condition. 2 of her medications were working against each other in a direct, predictable, completely documented way. 1 widened her vessels, 1 reduced her fluid volume. Together, standing up in a dark room at 2 in the morning, they were a fall waiting to happen. She had come within inches of a hip fracture, twice. I stopped asking about her symptoms. I started asking about her timeline. When did the swelling start? When did the fatigue begin? When was the last time a single doctor looked at all 5 of these together? She looked at me quietly and said, "I assumed someone had already done that." That sentence has not left me. I have been in practice for 15 years, and I hear a version of it more than any other. She left that appointment not with a new prescription. She left with a medication review appointment, a specific list of questions for her cardiologist, and the understanding that her safety depended on these medications being evaluated as a system, not as 5 separate decisions. Let me now show you what is actually happening underneath all of these signs, because it is happening in the majority of people watching this right now, and almost none of them know it. The root cause is not that any single medication is wrong. It is that the blood pressure regulation system involves multiple pathways. And when multiple medications each block a different pathway simultaneously, the combined effect on pressure is not additive, it is multiplicative. It is not 1 and 1 makes 2. It is 1 and 1 makes 4 under certain conditions, in certain bodies, at certain ages. The reason it goes undetected is that it does not announce itself. There is no alarm, no chest pain, no headline symptom. The body simply adapts slightly, gradually, month by month, until the margin disappears. Return to our plumbing analogy. Imagine 3 separate contractors, each installing pressure reduction devices in the same building without communicating with each other. Each device works. Each was installed correctly. Together, They drop the system pressure below the minimum needed to reach the upper floors. The upper floors, your brain, your legs' coordination centers, begin functioning below capacity. The building looks fine from the outside. The pipes are not leaking, but the top floors are quietly going dark. By the time a fall, a fainting episode, or a cardiac event makes the problem visible, the system has often been under-pressured for months or years. The warning window was open the entire time. Most people never opened it. Now I want to tell you about the everyday things you are probably doing right now that are making this process faster. Some of them will genuinely surprise you. First, taking your blood pressure medications at the same time as your morning coffee. Most people consider this harmless. Caffeine is a vasoconstrictor. That is the technical term for a substance that temporarily tightens blood vessels and raises pressure. Your medications are actively widening those same vessels at the same moment. Your body becomes a tug of war between chemical forces, pressure going up from caffeine, down from the medications, fluctuating sharply in the space of 90 minutes. That fluctuation, not just sustained high pressure, stresses vessel walls and creates the conditions for irregular rhythm and plaque instability. Second, hot baths or showers taken within 30 minutes of your medications. Heat causes blood vessels to dilate, to open wide across the entire surface of your skin. Combined with medications that are already dilating your deeper vessels, the total drop in resistance can be severe. This is a documented trigger for fainting episodes in seniors on combination antihypertensive therapy. The issue is not the heat. The issue is the timing. Third, low sodium meal replacement products or sports drinks marketed as heart healthy. Many of these contain potassium in quantities that, when combined with ACE inhibitors or ARBs, a class of blood pressure medication that already causes the kidneys to retain potassium, can push blood potassium levels into a dangerous range. The condition is called hyperkalemia, which simply means too much potassium in the blood, and at sufficient levels, it disrupts the electrical system that coordinates your heartbeat. It does not feel like anything until it does. Then it feels like a heart suddenly beating without a rhythm. Now let me show you what actually works and why it works at a level your body can feel within days. The combination clarity protocol morning. The first 15 minutes before taking any medication, drink 500 milliliters of water, that is 2 standard glasses, while still seated on the edge of the bed. Do not stand immediately. Sit upright for 60 full seconds before standing. This is not a suggestion. The reason, your blood pressure is at its natural morning low point, and your medications will push it lower in the next 30 to 60 minutes. Prehydrating while seated gives your circulatory volume a baseline buffer before gravity, medication, and the demands of movement all arrive simultaneously. The common mistake is taking pills standing at the kitchen counter. That position at that moment is the highest risk window of the day for a pressure drop event daytime. The midday check once each day, not obsessively. Once sit quietly for 5 minutes, then take your blood pressure with a home monitor. Record the number and the time. Do this for 14 consecutive days. You are not looking for a single alarming number. You are looking for a pattern, specifically whether your pressure drops significantly in the 2 hours after your medications. That window, documented over 2 weeks, is the single most useful piece of clinical information you can bring to your doctor. It transforms a vague conversation about dizziness into a specific timestamp data pattern. Doctors respond to data differently than to descriptions. Bring data if you have any existing joint, balance, or cardiovascular condition. Please check with your doctor before making any changes to your movement or medication routine. Evening. The position transition practice. Every time you move from lying to sitting or sitting to standing, count to 5 before taking your next step. This is not about being slow. It is about giving your autonomic nervous system the automatic reflex system that adjusts blood pressure when you change position, time to respond before your legs demand blood flow. This 5-second rule, practiced every single time, reduces orthostatic hypotension events by giving the compensatory reflex the time it needs to fire. The common mistake is standing and immediately walking. That sequence outpaces the reflex. Count to 5 every time, without exception. Within 2 to 4 weeks of consistent practice, most people report a measurable reduction in dizziness events on standing and improved morning energy levels. Now, here is something I want you to think about. Your age changes everything about how quickly blood pressure medication interactions develop in your body. The same combination does twice the damage at 65 that it does at 45. Research shows that in people over 60, the kidney's ability to clear medication slows significantly, meaning drugs stay in your system longer, overlap more, and interact more intensely than the prescribing dose was originally calculated for. How old are you right now? Write it in the comments. I'm not asking out of curiosity. I want to know which age group is watching most because it shapes every video I make next. Here is exactly what to do after this video ends. 1. Write down every medication you currently take, including the prescriber's name for each one. Include over-the-counter medications, supplements, and anything you take occasionally. This list does not exist anywhere in a complete form unless you create it. Point 2. Within the next 60 minutes, search the name of each medication paired with the phrase drug interactions, one pair at a time. Note any result that lists your other medications by name. 3. Schedule a medication review appointment specifically, not a routine checkup, a medication review. Use those exact words when booking. Ask for 30 minutes. It is a different type of appointment and requires that framing. 4. At that appointment, ask your doctor directly, has anyone reviewed this combination as a complete list? That one question reframes the entire visit. 5. Ask specifically about orthostatic hypotension testing, the seated to standing blood pressure measurement. If it has not been done in the last 12 months, request it. It takes 90 seconds and catches the most common and most dangerous combination effect in seniors. Point 6. If you are experiencing ankle swelling, fatigue, or dizziness, ask whether a calcium channel blocker is part of your current regimen and whether those symptoms began after it was added. The timeline is evidence. Present it as evidence. 7. Begin the 14-day blood pressure log described in the protocol. Bring it to your appointment. Patterns in a written log carry clinical weight that verbal descriptions of occasional dizziness do not. 8. Share this video with one person you know who is on blood pressure medication. You do not need to say anything. Just send it. Start with step 1. Do it today. The rest will follow. Everything I have shared today is for education and understanding. Your situation is specific to you. Use this as the starting point for a real conversation with your own doctor, not as a replacement for one. My name is Dr. Anthony Fauci, and I have been in clinical practice for 15 years. I made this video because I have sat across from too many patients who arrived at my office carrying a pharmacy bag and a look of genuine confusion. People who had followed every instruction they were ever given and still ended up dizzy, exhausted, and frightened in their own homes. That is not a personal failure. That is what happens when a system evaluates medications individually and discharges patients without ever asking, what does this look like together? Here is what I want to be precise about. This is not a problem of negligence. It is a problem of architecture. Primary care appointments average 11 minutes in this country. A cardiologist's follow-up is focused on one organ system. A pharmacist's interaction check runs through a database that flags severe interactions, but is not calibrated to the compounding subtleties of 3 mild effects converging in a 70-year-old body. No single professional is failing you. The structure simply was not designed with your complexity in mind. This channel exists because that gap needs someone standing in it. Subscribe to Fauci Health Insights, not because the number matters, though 50. Zero voices saying this information should be free matters more than you know, but because every subscriber signals that there is an audience for medicine that treats people as intelligent, capable, and deserving of the real explanation. If this reached you at the right moment, send it to one person who needs to hear it. You may never know what that one share does for them,